Hello dear students and the members of the fraternity of Physiology and Medicine. This video is on respiratory physiology and it's a topic which is at the borderline of theory and the practical or laboratory physiology. It's the measurement of the residual volume. Why did I select this topic? It's because normally we use a method called spirometry in the lab for measurement of lung volumes and capacities. All the volumes can be measured except the residual volume. The normal Hutchison spirometer that we use, it cannot measure the residual volume, and therefore we have to employ special techniques or special method to measure the residual volume, and therefore this topic was selected to discuss those two methods which are used, the helium dilution method and nitrogen washout method. So let's start from the very basic with defining the residual volume. What is the residual volume? It's the volume of air that remains in the lungs even after maximum forceful expiration, maximal expiration. So when we breathe out maximally, even after that, some amount of air is always going to remain in the lungs, and therefore that remaining air or volume is called as the residual volume. Residual as in remaining. The volume is about 1200 ml. Now, why can't we measure this normally? The answer is very obvious. The subject breathes in and breathes out through the into the spirometer. So the air that is never going to come out even after maximum forceful expiration, the air that is not going into the spirometer, how can we measure it? Therefore, residual volume cannot be measured, and the capacities that include residual volume can also not be measured by our normal Hutchison spirometer. Functional residual capacity or total lung capacity, these capacities include residual volume, and therefore they also cannot be measured. So we use these methods, as I mentioned, helium dilution method and nitrogen washout method. And this video is about these two methods. Right. So as I mentioned, residual volume cannot be measured by spirometry, and therefore methods used are helium dilution, nitrogen washout. Now, first thing, both these methods are based on the law of conservation of mass. Please note this, that both the methods are based on this. There are a few differences. Helium dilution method is a closed circuit method, whereas nitrogen washout method is an open circuit method, as we will see in the subsequent discussion. Right. So let's take them one by one. Helium dilution method. The approach taken is volume of distribution. That is the approach taken for helium dilution method. There is a known mass of helium, known mass or known volume of helium, and it will be distributed in a specific compartment, and we are measuring the volume of that compartment. We will see what that compartment is with a diagrammatic representation. So basically, volume of distribution of helium is going to be ascertained by this method. Why do we select helium? Helium is inert, helium is relatively non-toxic. Apart from that, it is relatively insoluble, and therefore helium is going to diffuse, helium is going to flow into our lungs from the spirometer. It will flow into the lungs, but it will not diffuse into the pulmonary circulation. It will not diffuse into the blood, or rather it will diffuse very slowly, insignificantly, not at all. That means it stays in the lungs, whose volume we are going to measure. Okay, it's going to remain in the system whose volume we are measuring. That's the most important reason why we choose helium for this particular method. I'll describe this once again in detail with diagram. Right, but that's the reason why helium is chosen, that it does not cross the blood-brain barrier rapidly, it does not cross the respiratory membrane rapidly, it stays in the lungs. Once you inhale helium, it stays in the lungs, it does not diffuse into the blood, because we are measuring the volume of the lungs, the residual volume which we measure. Right, volume of distribution, the principle for this approach is as follows. Here is a known mass of this particular substance, and this known mass is placed into this particular volume. Then it will disperse uniformly into this compartment. Once it is dispersed uniformly into the compartment, into this entire volume, then we select the sample and measure the concentration of this particular substance. I am just trying to first establish the basic principle on which the helium dilution is based. So we will then select the sample and see the concentration of this substance after it got dispersed uniformly. And then concentration of a substance is the ratio of mass to volume. Mass upon volume will be the concentration of that substance, and that is what we are going to measure, right? Concentration, or once the helium is diluted, we will see the concentration of it, how much it got diluted. Okay, that's the basic principle. Now, if the mass is constant, that's one prerequisite. As I mentioned just now, helium is used because it does not escape the airways, it does not escape from the lungs, it does not diffuse into the blood. Because why it's required is because spirometer and the lung is going to be one system at the start of this particular procedure, and we don't want the gas to escape this system. We want the mass of the helium to remain constant. It should not decrease, it should not go anywhere. So if the mass is constant and if we measure the mass and concentration, then we can calculate the volume of that physiological compartment. So if concentration is equal to mass upon volume, then volume is equal to mass upon concentration. We will know mass, we will know the concentration, then we can calculate the volume of that compartment. In this case, a subject will be asked to breathe helium. Its mass is known and it remains constant. Helium does not escape from the airways. So from the mass of the helium and its concentration, the residual volume is going to be calculated. Now coming to the most important part, the method. As you can see in this representative diagram, helium concentration or rather a known concentration and mass of helium is placed into the spirometer. What the diagram shows is a spirometer, a tubing with a valve and the lung. So here is a representative diagram of the lung. Now the most important part that you should note here is that first the formula C1V1 is equal to C2V2. Initial concentration of helium, that's C1. V1, initial volume where the helium was placed, that's the volume of the spirometer. Yes, that's V1. C2 and V2, if you understand that, you have understood the method then. So please understand what is C2V2. First of all, C1V1 is equal to C2V2, that's very basic, you know the formula already. What is C2 and V2? You must understand that. So listen to the method. There is a valve over here. Here is a spirometer. Here is the lung. We are going to measure the lung volume. Now, as this technique starts, the valve will be opened. And the moment the valve is opened, now listen to this part very carefully. Moment the valve is opened and the subject starts breathing through this tubing, then spirometer and the lung of the subject will become one unit, one system, one compartment. That's the most important part that you should realize in this method. In fact, next diagram will illustrate this. The valve was opened, subject starts breathing at that very moment, and the helium now from the spirometer through this tubing goes through the respiratory passage and goes into the lung. But what you should have noted is now the spirometer and the lung has become one system or one compartment. Helium is going to be distributed uniformly, dispersed uniformly in this one compartment or this one system. What is that system where helium is going to be diluted? The spirometer and the lung. That's where in that entire compartment or that entire system, the helium is going to be diluted. Patient is breathing, helium goes into the lungs with inspiration, and the patient exhales, the air goes back into the spirometer. So please understand that right from the start till the end of this procedure, the V2 will remain constant. What is the V2? Volume of the spirometer and plus volume of the lung. That will remain constant because it's a closed system. Just the air goes from spirometer into the lung, and from the lung the air goes back into the spirometer. That's it. So this entire volume is going to remain constant. Just it is that when the subject inspires, the lung volume will increase and the spirometer volume will decrease. And when the patient exhales out into the spirometer volume will increase and the lung volume will decrease. But throughout the technique, throughout the procedure, spirometer volume plus the lung volume, that's the V2, that will remain constant. Remember that it's a one system now the moment the valve was opened, and the helium that was placed into the spirometer is going to flow through this tubing and will enter the lung. So now C2, that's the final helium concentration. That is after the helium has got dispersed and distributed evenly into the compartment. Look, the helium will be evenly distributed into that entire compartment which I am mentioning, which includes lung volume plus spirometer volume. That's the one compartment or V2 in which the helium is evenly distributed and it reaches equilibrium. Helium reaches equilibrium eventually. What is the meaning of that? It means concentration of helium will be same in the spirometer, same in the airways, and the same one in the lung. It has got uniformly distributed, and therefore you can take the sample for the concentration of helium, which is C2. Remember, C1 V1 is equal to C2 V2. C2 is the final helium concentration. As you can see in the diagram, there was the initial helium concentration into the spirometer and volume of the spirometer. So let's take some hypothetical values. C1, let's say 10%, and V1, volume of the spirometer, let's say 2 liters in which the C1 was placed. Then C2, helium has got diluted into this entire volume, into this entire one system of spirometer plus the lung, and that's C2, final helium concentration, and the V2, as I said, it's volume of spirometer plus volume of the lung, that's V2. So that is how we can calculate the residual volume. Now let me just revise it once again. There is a spirometer that contains air with 10% helium. This is the initial helium concentration, let's say C1, and that's 10%. The moment we open the valve near the mouth of the subject, spirometer and the lung becomes one compartment. Yes, that is what precisely the most important thing to be considered. Becomes one compartment or one system, and the gas is going to be distributed into this entire compartment. So therefore, now you can understand once again why we chose helium. If the helium was inspired and let's say it was diffusing very rapidly into the blood, what will happen? That means it was escaping the volume which we are measuring. We don't want the gas that will escape this volume which we are about to measure, right? And therefore, that's helium suits perfectly for that. It will not diffuse and go into the blood. It will remain constant. The mass of helium will remain constant throughout the experiment. It will just get distributed from the spirometer into this entire volume of spirometer plus the lung, but it will not decrease and by going into the blood. That's the property for which we actually chose helium. Right. So we need such a gas that does not escape the compartment which I mentioned just now. Helium is used for this purpose as it is purely soluble. It diffuses slowly across the respiratory membrane and therefore it will not enter the pulmonary capillaries. Its mass will not decrease. As I mentioned, mass should remain constant. V1, the initial volume, is that of the spirometer in which helium is present initially. It's about, let's say, 2 liters. We have taken some hypothetical values. The amount of helium in the spirometer in the beginning is 10%. Let's say the concentration of helium 10%. Valve is opened, subject starts breathing through the spirometer, and the spirometer plus the lung becomes one system and helium equilibrates in this entire system. So that's the meaning of helium dilution method. Helium is going to be diluted into this compartment. Spirometer volume and the lung volume remains the same throughout the experiment. As I mentioned, when the patient inspires, lung volume increases and spirometer volume will decrease. And when the patient exhales out, the lung volume will decrease and the spirometer volume will increase. But spirometer volume plus lung volume, that's V2, where helium gets diluted, that remains constant throughout the experiment. Right. So that's what we have seen so far. And of course, C1 V1 is equal to C2 V2. Again, it's a repetition, but I just want to reinforce this point. The basic that you must understand is the formula C1 V1 into C2 V2 is equal to C2 V2. And what is V2? V2 is where helium is going to be diluted, and that V2 is spirometer volume plus the lung volume, which makes one system as the valve is open. Right. And therefore, now what is left is measurement of the lung volume, right? Look, all the things are known to us. C1, V1 was known to us. C2 will be known to us. Final helium concentration is C2. We will collect the sample and measure the final helium concentration, let's say 5%. And V2 was this lung volume plus the spirometer volume, that's together is V2, right? We already know the spirometer volume. So what is left in the equation is just the measurement of the lung volume. And therefore the equation, if we solve it, it becomes something like this. C1 V1 is equal to C2 into Vs, that's spirometer volume, plus Vl, that's lung volume, and therefore lung volume is equal to spirometer volume into C1 upon C2 minus 1. We solve the equation by putting and then we put the values into the equation, we will get the lung volume. That's the method of helium dilution for measurement of lung volume. Now the only question remains in all this is, which lung volume is VL? Look, we have sorted out everything. We knew all the other things like spirometer volume and concentrations of helium C1 and C2, and then we have calculated by solving the equation. VL is calculated like this. This is the lung volume that we are going to calculate. The only question remains is, which lung volume is this VL? I repeat once again, this was the lung volume which we are measuring. This is the lung volume and plus the spirometer volume, which was V2 put together, actually speaking. So, which volume is this actually, the lung volume which we are describing? Is it residual volume or is it, what volume is it? Look, it depends on this lung volume, which volume we are measuring will depend on what was the lung volume at which the valve was opened. You get the point? There is a valve over here. We are going to open the valve and then the helium is going to be dispersed into this entire volume between the spirometer and the lung, this entire V2. When we open the valve, at that particular moment, what was the volume of the lung? If it was residual volume at which we started the procedure, then the lung volume that we are measuring is the residual volume. So, I mean, imagine this. This procedure was started at the end of maximum forceful expiration. At the end of maximum forceful expiration, the volume of the lung is the residual volume. Okay, and residual volume plus the spirometer volume is going to make one compartment at that very moment. I repeat once again, listen to this. At the end of maximum forceful expiration, what remains in the lungs? The residual volume. And at that moment, at that very instance, if you open the valve, what then becomes one system? The volume of the spirometer and the residual volume, because that is the moment at which the valve was opened, when the lungs were at residual volume. Yeah, that is at the end of maximum forceful expiration. Or else, if the valve is opened at the end of quiet expiration, at the end of normal quiet expiration, the lungs are at functional residual capacity. What remains in the lungs? The functional residual capacity. So, that will be the lung volume in which the helium is going to come, and there will be dilution of helium in this entire system. Do you understand? The instance, the moment at which we open the valve, what is the lung volume at that instance? If it is a residual volume, then we are measuring residual volume eventually, isn't it? Because then the residual volume and the spirometer is making one system at that very instance. So, I repeat once again, you must understand this. Opening of the valve creates one system of spirometer plus the lung volume. Once you understand that, you have understood the method completely. So, if we opened the valve and the procedure was started when the lungs were at residual volume, that means the VL, the lung volume which we are measuring is the residual volume. Right. So, that's about the helium dilution method. It all depends at what volume you open the valve. And helium, the point that should be noted is helium is going to be diluted in that entire system of spirometer plus the lung volume. And then of course we also saw that we solve the equation for C1V1 is equal to C2 into V2. V2 is actually spirometer volume plus the lung volume, and therefore we solve the equation. Take VL on the other side, lung volume, VL is lung volume, and solve the equation or put the values into the equation, and you get the VL, the lung volume. So, that was the procedure Basically, the point to be remembered again, if you have some point was not clear, helium is going to be diluted into some compartment. As I said at the start of this discussion, a known mass of the substance is going to be dispersed into that entire volume. So, and we are measuring that entire volume. In this case, we are distributing the helium into the volume which is spirometer volume plus lung volume, and therefore we already know the spirometer volume. What will be the lung volume then? That can be calculated, right? So that's the helium dilution method, a closed system, a closed circuit method, as I mentioned previously. Just last point, what are the limitations of the technique? There are certain limitations to the technique. COPD, for example, can be one limitation, and it does become a limitation to this particular method. Why is that? Because look into the diagram again, you will realize if there is a COPD and let's say some airways are plugged or blocked, that means some area of the lung will not be available for the helium distribution. Look, let's say some airways were plugged, and because of that, this is the area of the lung, hypothetically speaking, some area of the lung is not available. That means helium does not reach that area. Helium does not reach and get diluted into that part. So, this since this area, this part of the lung is not available because air is not reaching there, that means the helium dilution will be into a relatively lower volume. You can see here that because of the airways plugging or any such reason, some part of the lung was not available. I mean, air was not reaching that area. So, helium will not reach there, and therefore, that V2 which we are saying, the spirometer volume plus lung volume, that's the V2. That V2 will be less. I mean, helium is getting diluted in a lesser volume. So, when you collect the sample for helium concentration, it will be slightly higher than what it should be, and therefore it does not become a very reliable thing then. So, that's a limitation to this method. Helium does not have the entire lung volume to get diluted. So, that's the helium dilution method, and now we see the other method, that's nitrogen washout method. Remember, in the case of COPDs, I mentioned just now, in the helium dilution method, the dilution would be lower than expected because the entire lung was not available, and because the dilution will be lesser than expected, therefore it will give a falsely high value for residual volume or whatever volume you were measuring. That's a limitation to the helium dilution method.